Medurstand. Understanding medicine.
Professor Aziz Rehman from Medurstand, and today we are going to demonstrate the clinical methods in GIT, how to examine gastrointestinal system. Now finally I will do the auscultation of abdomen. The auscultation can be done if you suspect intestinal obstruction. Then we are interested to see if the abdominal sounds are intact or not. So you use the stethoscope, and I think the part which represents small intestine best is this part, somewhere in the middle of umbilicus and this this part, and I will put stethoscope here and keep it there for like 60 seconds. Like this. And you know, normally intestine movement is not it's sometime when we have eaten there may be more intestinal movement, when we are hungry maybe less, and if there is intestinal obstruction you would hear very frequent and very loud sounds, and this is because of excessive peristalsis which is trying to overcome intestinal obstruction. So that is one sign of intestinal obstruction. On the opposite side, sometimes there may be no movement at all. You auscultate for maybe 1 minute or even longer, you don't hear any sound at all, and that may be sign of paralytic ileus. If somebody has complete paralysis of intestine, there may not be any intestinal sounds heard here. And in fact, I've observed that because abdominal sounds are not there, if somebody has paralytic ileus, you will be able to appreciate cardiac sound and respiratory sounds coming to this part, because the abdomen has become very quiet, and these sounds may be heard on the in this part, and that would indicate intestine the paralytic ileus. Another reason to auscultate the abdomen is to look for bruit. Now, one condition which you could have bruit is renal artery stenosis, and that is something which you suspect when somebody has hypertension. One cause of hypertension, especially intractable hypertension, is renal artery stenosis. So you would specifically look for renal bruit. And how do we do that? We put a stethoscope in the ears, and this is the area. This is the lumbar area, and you put a stethoscope here and press it little hard so that I get as close to the kidneys and renal artery as possible here, and auscultate. Normally there should be no bruit, and then I do the same on the opposite side. Again nothing. And then I will look for any bruit on the aorta. Patient with aortic stenosis because of atherosclerosis or coarctation, there may be bruit. Bruit is actually a loud systolic murmur-like thing, and it could be heard during systole as well as diastole. So in these peripheral vessels there is no bruit normally, but if there is one, that would indicate stenosis. So from here, like this, I think up to this aorta, then bifurcates, maybe on both sides I can also auscultate if there is a real suspicion of any vascular disease. So that was the auscultation part.